Lack of sexual desire in men is something commonly ignored by the affected and also large parts of the medical community. In this video, I will explain to you why sexual desire is the foundation for sexual activity overall and what you can do to maintain and enhance sexual desire without using any medication. My name is Stefan Buntrock. I'm a urologist and sexologist, and if you like watching UroChannel, I would very much appreciate your subscription and a thumbs up for this video. Overall, sexual desire is the ignition for sexual activity and also sexual functionality. Without sexual desire, sexual arousal gets difficult, and this has an enormous detrimental effect on erectile function. Getting an erection is much harder if you don't feel like it. Sexual desire also modulates the ejaculatory latency time. For example, young men who experience premature ejaculation due to very high levels of arousal. And this has nothing to do with premature ejaculation as a pathological condition. It's just that they get so excited that the ejaculation latency time may occasionally drop down to a few seconds. The aging process is the big destroyer of many functions of the body, and it is no different with sexual function and sexual desire. This means that scientific studies found a decline in sexual desire with age time and again. However, sexual desire has a complex nature and depends upon both internal and external variables. One of the key requirements is physical health and overall well-being. But even then, sexual desire is modulated by external factors such as relationship status and quality of the relationship. Being stressed out because of a tough job, for example, also plays an important part. Two large studies from Finland have shown three major predictors which determine sexual desire in the aging male: good health, sexual self-esteem, and active sexual history. In other words, stay healthy and use it or you will lose it. Diseases of any kind will not only weaken sexual function, but also go along with medication that in itself may have a negative effect on sexuality. Problems with sexual function like erectile problems resulting from diabetes or high blood pressure will in itself lower male self-esteem and lead to a decrease in sexual desire. So here's my first tip to keep up and enhance sexual desire. Pay attention to what you eat. Processed food is not good for the body and overall health. The obesity pandemic we are experiencing in many countries of the world is a result of faulty eating habits and food designed to max out human taste buds. In a bad way, because a lot of sugar and saturated fats are involved, not to mention all the other unhealthy ingredients. So my advice is to change to a diet that mimics the Mediterranean diet. I did a video on that last year, which I will link at the end. Try not to overeat and avoid obesity at any cost, because obesity will cause your testosterone levels to drop down, resulting in a simultaneous drop in sexual desire. At the same time, obesity will cause hypertension, the master destroyer of erectile function, and diabetes. Diabetes is associated with low testosterone and LUTS, lower urinary tract symptoms, that is. Benign prostatic enlargement is also associated with obesity and LUTS. We know from large-scale studies that LUTS is a major contributor to low sexual desire and loss of sexual function. Tip number 2 is physical exercise, because physical fitness leads to overall well-being and will enhance sexual desire. Train your cardiovascular system with endurance exercises, but also go to the gym for strength training, and don't forget to include something for your overall flexibility. Tip number 3 is sleep. We spend almost half of our lives in bed sleeping, and sleep has such an enormous importance for our daytime performance. It is therefore important that you get enough sleep. But additionally, it is important to get restful sleep. Here is where breathing comes into play. Nocturnal breathing disorders are common. Major risk factors are being male, over 50, and being obese. This is why many men suffer from sleep apnea in the second half of their lives. Sleep apnea leads to low testosterone and increases the cardiovascular risk quite dramatically. So if your partner wakes up in the middle of the night because you don't breathe, go to your doctor right away and get your sleep examined. Tip number 4 is about smoking, alcohol, recreational drugs, doping with anabolic steroids. All of this will have a negative effect on sexual function on the long run, so try to avoid all of it. Tip number 5 has to do with your partner, because sexual activity often involves a partner. Talk to your partner and know your partner's sexual script. Why you should do that and what to do is explained in this video. And afterwards, don't forget to watch this video on diet. See you soon. Bye bye.